Hello, my name is D. Bell and welcome to BLACKTREE TV. Today we're here in Beverly Hills with two of the finest doctors in Beverly Hills, Dr. Brian Evans and Dr. Susan Evans, who happen to be husband and wife. You may have seen them on the hit TV show Dr. 90210 on E! Check your local listings for that. But today we're definitely going to get inside their heads and see what they're all about.
Dr. Evans, how are you?
Good.
Great, excellent. How can I help you today? I'm Dr. Brian Evans. I practice here in Beverly Hills. I specialize in body contouring as well as facial rejuvenation.
10 years ago, everybody was really hush-hush about work they've gotten done, especially celebrities. So what do you think has contributed to this rise in everybody wanting surgery these days?
Well, I think there are a couple of factors. You know, I think people are wanting to look as good on the outside as they feel. So there's been sort of a resurgence of just wanting to look your best. Because of these television shows, there's been a lot greater awareness with plastic surgery.
I want plastic surgery because after having 3 pregnancies close together, my stomach has lost all firmness in it and I can't do anything about it.
Well, what we can do is a total lower body contouring. Just simply doing liposuction, I feel, is going to leave you with even more loose skin.
How long have you guys actually, I know it started off with a couple of other doctors and you guys joined on board. When was that? When did you guys join?
And we've filmed 2 seasons, and we've been on there now for 2 seasons.
Is there a casting company that gets these patients?
No, actually, they are our own patients.
Oh, really?
And you know, the first year was a little bit of a challenge because we asked our patients and we asked anyone that were interested. And now it's quite easy. We have so many people are asking to be on the show, so you know, it's pretty straightforward.
All right, so now we've gotten one side done. Then we'll remove the excess skin from this side. Okay, our scalpel.
When surgeries go wrong, I would like to call it, is that something that is common that can happen where somebody is just not fit for it and you tell them over and over? Obviously you said that if you think they're not a candidate, then you let them go. Do you see some doctors out there that just see money and say, you know what, I'll just take this patient on just because it's good money?
Well, you know, I can't really speak on behalf of the other physicians and what their motivations are to do surgery. Again, I think anyone that practices safe medicine and exercises common sense, you know, hopefully they'll have a better outcome. Having said that, surgery is risky. Even in the best intentions and the most pre-screened patient, complications do occur. It's a fact. It's a part of being a surgeon. Any surgeon that says they never have a complication, either they're lying or they're not doing surgery.
Right.
I can't really comment on any case in particular. If I'm not involved with it, it's not fair to the family, it's not fair to the surgeon.
Now we're going to start the facial rejuvenation. I'm going to apply a bleaching chemical peel to the area.
The whole tag team with your wife, man, how did that come about?
It just worked out really well. I mean, we met years ago during our training period in New York, and from there, you know, we fell in love and things worked out from there.
And you guys moved to LA?
Moved to LA, and we're 4 kids deep, so you know.
So you got to get these surgeries going.
Hi.
Hey.
How are you?
Good, great.
Good. You're looking great.
Thank you.
Oh, my goodness. Who is this?
Thank you so much.
I'm Dr. Susan Evans, Cosmetic Dermatologist in Beverly Hills. I specialize in enhancing the face with facial fillers, laser resurfacing, and pigment improvement.
Do you enjoy having a patient that you can work on along with your husband?
It's fulfilling to double team because I'm really confident about the type of plastic surgery that he's giving them. And I'm also, of course, comfortable about the cosmetic dermatology that I'm giving and the skin quality, because it's oftentimes not enough to just improve the surgical component or pull the skin. You also want to improve the skin quality. So we actually work pretty well together, and we did prior to getting married in our exclusive fields, and we've been doing it for a long time, and it's a good plan.
Dr. Susan is a wonderful mother. First of all, she's absolutely gorgeous. She's had twins, and she bounced back, and she's in shape. She works out, and she takes our son to school every day. At home in the evenings, she reads a story to the kids, and she also maintains a practice.
You guys are two doctors in a family that is, and of color, might I add. That goes back to the whole Cosby show thing. People kind of think of that, and you guys have that same effect.
Family is very important, and it's interesting that you call us the Cosby, because we've been referred to as the modern day Cosbys.
Nice.
And I'm always like, yeah, Claire had one more child than I did, and I don't know how she did it. The fact that I'm a wife and a mother is so fulfilling, but it's also really fulfilling and important to me that I'm a doctor and that I take care of my patients.
We have Kanye West's mom. I'm sure you've seen it all in the news, Dr. Donda West. And she had an unfortunate situation that happened during a surgery.
Well, my thoughts and prayers are off to the family. I mean, it's a very unfortunate thing to have a loss of a great woman, and she sounds like she was amazing. I did not know her at all, and it's just really unfortunate and very sad to hear that she passed. I don't know the details, but whatever the details are, it's awful, and it's really sad to hear about. I honestly don't know doctors that take patients that know that they have health risks and put them under the knife knowing that there's going to probably be a problem. I'm just not aware of anybody that does anything like that, and it definitely goes against our Hippocratic oath, or you know, what we are as physicians and surgeons, and how we should honor our medical degree.
Refresh Skincare. Now, this is a product that you obviously support. How much of an influence do you have in this product, Refresh? Is this your product line?
Well, I was essentially, yes, it is. It is my product line, and I have been working on it and actually using it for many years, even before I came here to Beverly Hills. And it was always very popular within the office, and I would offer it to patients for different sort of skin problems, because oftentimes they didn't want to get a prescription and have to go to the pharmacist afterwards and get things. And most of these things are cosmetic, so it's not an insurance issue. But we decided to go public with the product line about 5 years ago, and it's done really well, and it's very easy to get over the internet, and it's inexpensive, but it's high quality. So we're really happy to offer that to people. It's available online. You can go to refreshskin.com, or you can go to our website, which is bedfordplasticsurgery.com, and it'll link you to Refresh Skincare if there's some things that you want to improve about your skin.